Are you sick of your newborn baby's sleeping schedule? How to fix it? Hello, everyone. Welcome to Medconnect. Today, we're talking newborn babies' sleeping problems and how to deal with it. But before we get started, please hit the like, comment, and subscribe buttons so you can stay updated with our videos. Welcoming a new baby into your life is a joyful experience, but it can also be filled with sleepless nights and exhaustion. Sleep problems are common in babies, and they can leave parents feeling overwhelmed. 1. Sleep regression. Problem. Sleep regression is a phase when your baby's sleep patterns temporarily disrupt, usually at around 4 months and again at 8-10 months. It can lead to more frequent night waking and shorter naps. Solution. A. Consistent routine. Maintain a consistent sleep routine to help your baby establish healthy sleep habits. B. Patience. Recognize that sleep regressions are temporary and try to remain patient. Circa adjust expectations. Adjust your expectations and adapt to your baby's changing sleep patterns during these phases. 2. Night wakings. Problem. Many babies wake up during the night, seeking comfort or nourishment, which can disrupt your sleep as well. Solution. A. Feeding schedule. Establish a consistent feeding schedule during the day to reduce the need for night feedings. B. Sleep training. Gradual sleep training methods can help teach your baby to self-soothe and sleep longer stretches at night. Circa team effort. Share night duties with a partner or support person to ensure both parents get enough rest. 3. Nap time struggles. Problem. Some babies have difficulty napping during the day, which can result in overtiredness and fussiness. Solution. A. Create a calm environment. Make sure the nap area is quiet, dark, and comfortable for your baby. B. Watch for sleep cues. Pay attention to your baby's sleep cues and put them down for a nap at the first signs of tiredness. Circa consistent schedule. Stick to a regular nap schedule as much as possible to help your baby establish a rhythm. 4. Separation anxiety. Problem. Around 6-8 months, babies may experience separation anxiety, making it difficult for them to fall asleep on their own. Solution. A. Comfort objects. Introduce a comfort object, like a soft toy or blanket, to provide security. B. Gradual transition. Gradually work on teaching your baby to self-soothe and fall asleep independently. Circa reassurance. Offer reassurance by checking on your baby at intervals without picking them up. 5. Teething discomfort. Problem. Teething can cause discomfort and pain, leading to disrupted sleep patterns. Solution. A. Teething toys. Provide safe teething toys for your baby to chew on during the day. B. Pain relief. Consult with your pediatrician about safe pain relief options for teething discomfort. Circa extra comfort. Offer extra cuddles and comfort during teething phases. 6. Environmental factors. Problem. Environmental factors like room temperature, noise, and lighting can affect your baby's sleep. Solution. A. Comfortable sleep environment. Ensure the room is a comfortable temperature, quiet, and dark. B. White noise. Use white noise machines or fans to drown out background noise. Circa blackout curtains. Install blackout curtains to create a dark sleeping environment. Conclusion. Sleep problems in babies are a common challenge for parents, but with patience, consistency, and the right strategies, you can help your little one establish healthy sleep habits. Remember that every baby is unique, and what works for one may not work for another. Be flexible and open to trying different solutions until you find what helps your baby sleep soundly through the night, allowing both you and your baby to enjoy the rest you need for a happy and healthy journey together. Thanks for watching. If you liked this video, please like, comment, and subscribe to our channel. If you have questions or want us to talk about something specific, just let us know. Take care of yourself. See you soon.